Hey guys, welcome back. And today we are going to discuss about other nursing diagnosis and care plans. Or nursing diagnosis is about risk for infection. So here you can see the nursing diagnosis. So more than four nursing diagnosis I have added here. Risk for infection related to invasive procedure as evidenced by high body temperature or abnormal vital signs. Second one, risk for infection related to malnutrition as evidenced by what you have observed that you have to write. Then risk for infection related to chronic illness as evidenced by what you have observed in the patient's situation that you have to write. Risk for infection related to the presence of medical device in the body as evidenced by what you have observed. Then risk for infection related to break in skin integrity or risk for infection related to wound or risk for infection related to burns as evidenced by what you have observed. So while writing, you have to write a risk for infection related to invasive procedure as evidenced by high body temperature or abnormal vital signs. Now we will see the nursing diagnosis and care plans. Okay, so here you can see the care plan. So as like previous care plans, you have to add all these columns. Okay, first column is assessment. Okay, assessment. Second column is diagnosis. Okay, third column is planning. Fourth is rational, then implementation and evaluation. So first assessment. Under assessment, you have to write subjective data and objective data. What is subjective data? What you have observed, that is objective data. And what is subjective data? What your patient saying about their condition. Okay, what they are feeling about their situation. So subjective data means what patient is saying about their condition, and objective data means what you have observed from the patient's situation. So subjective data is patient says that he or she is suffering from high temperature and feeling tiredness or pain. Objective data is patient looks dull and tired. So subjective data means what the patient says about their condition. What is objective data? What you have observed from the condition. Second column is diagnosis. In diagnosis, you have to write two things. One is diagnosis, another one is goal. Okay, so the diagnosis is risk for infection related to invasive procedure as evidenced by high body temperature or abnormal vital signs. Okay, what is the goal? The patient will get relief from infection as evidenced by normal vital signs. Okay, the patient will get relief from infection as evidenced by normal vital signs and absence of fever. Okay, next we will write the planning. Okay, in planning, always start your planning with history collection and physical examination. Okay, so if mental health conditions means you have to write mental status examination also. So first planning is do history collection and the physical examination. What is the rationale? To understand the general condition of the patient. Always use to understand, to provide, to know, to realize, to analyze in rational. Okay, to understand the general health condition of the patient. Implementation, always write your implementation in past tense. So do history collection means what you will write. Done history collection. Okay, done vital signs and recorded. Okay, recorded vital signs. And you can write the TPR, temperature, pulse, respiration, heart rate, etc. So while writing all these things specifically, clearly, what will happen? That will enhance the credibility of your writing. Okay, so if it is very good to mention all the results in the implementation column. Then assess the skin for infection. That is the second planning. For what? To provide proper care to the patient. Okay, in implementation, assess the skin and infection and observe redness, swelling, warmth, and drainage. Okay, next thing is monitor blood count and laboratory values as per the doctor's order. For what? What is the rationale? To know the level of infection. What is the implementation? Monitored WBC count. Especially you can mention WBC count because the patient is having what? Infection. So you definitely have to check the WBC count, right? So monitor WBC count and other blood count and report it to the doctor. Next thing, thoroughly observe the patient and thoroughly observe the specific body part. For what? To understand the signs and symptoms of infections in the specific area. Observe the surgical sites or observe the catheter site or observe the invasive device entry point, whatever. It's depend upon your condition, I mean your patient's condition. Then practice hand hygiene and use aseptic techniques. That's very, very important. For what? To avoid the chance of developing and spreading infection. Okay, in implementation, practiced hand hygiene, washed and cleaned the hand before and after all the patient contact and use gloves for all the procedures. Next planning, ensure proper cleaning and sterilization. For what? What is the rationale? To minimize exposure to any pathogen. Okay. What is the implementation? Ensured. Okay. Ensure proper cleaning, ensured proper sterilization procedure, and recorded it. Okay. Recording is very, very important in that point because when they have sterilized, okay, that you have to specifically mention. Then educate the patient and family regarding proper wound care. That's very, very important. For what? To prevent the entry of infection into the specific body part. Given health education or educated, given health education and showed some small videos, how you have educated the family and patient regarding infection control. You have to give some relevant evidence, right? So you can write, I have shown a small video, so I have demonstrated the hand washing process and I have demonstrated the wound healing process. Okay, from the less infected area to the more infected area, you have to clean. Like that, simple things can prevent the entry of infection in the wound site. So you can explain the things in that way, and that you can write in the implementation. Then encourage adequate nutrition to the patient. What? To support the immune function. Encourage the patient to follow healthy diet, and you can write started a balanced diet and with rich vitamins, minerals and proteins, etc. Then encourage adequate fluid intake. Okay, for what? To maintain hydration. That's very, very important because the patient is having high fever. Okay, encourage and observe the patient's water intake and also check the skin integrity. If they're not taking proper water, what will happen? The skin will get wrinkled, right? So you can write that also in implementation, or check the skin integrity. Then administer medication as per the doctor's orders. For what? To prevent the entry of infection in the body or to reduce the symptoms. Administered antibiotics or administered NSAIDs or administered antihistamines. Okay, whatever that you can write. Then collaborate with other healthcare team. That's also very, very important to provide complete quality care to the patient, right? Then collaborated and contacted nutritionist and infection control team. Okay, so like this, you can write the planning. Almost all the planning I have added here. And in evaluation column, what you have to write? Past tense of your goal, right? The patient will get relief from infection. So what you will write in evaluation? The patient got relief from infection, or patients, okay, got relaxation or relief from infection, okay, or the patient's infection reduced, or the patient got relief from infection as evidenced by normal vital signs with no indications of infection. So like this, you have to write your nursing diagnosis and care plan for risk for infection. Hope you understand, guys. Okay, next video we will see another nursing diagnosis and care plan. Thank you.